Hello people, so this is the second part of the headache video. In the first part I discussed the general approach to any headache station, and now I would be moving in the details of the headache, each type of headache, and I'll be discussing their specific point in the history and the psychosocial and the management according to the NICE-CTS guidelines and details. Okay, so migraine is one of the commonly recurrent stations, and it is one of the chronic headaches. So when you enter the cubicle, the patient will be telling you they'll be telling you, the doctor, I've been having this headache and for a long time now, and it comes and goes. So when you do the Socrates, they will tell you that it is unilateral headache. Okay, unilateral headache, and with the onset they will tell you that it starts gradually, and sometime they will tell you that they can feel it coming. Okay, they will tell you that they can feel it coming, which means that uh, they have migraine with aura. So they can tell you that they can see this flickering of lights or numbness. They feel a bit numb, or there's tingling sensation in fingers. So they will give you something related to the migraine aura. So sight is unilateral, and then the onset is gradual. They can sometimes feel it coming. Character, they will tell you that it's a throbbing type of headache, and what makes it better, what makes it worse. So they will tell you certain known triggers. There will be known triggers. They will tell you that, there are certain foods, or when they are anxious or they're excited, there is emotional triggers, or with disturbed sleep, or with tiredness, or with loud sounds, intense lights. So they will give you some of the known triggers with when you ask that is there anything that makes it worse. Okay, and there is usually no radiation. And what makes it better, they might tell you, the doctor, I have tried taking paracetamol, it doesn't help, or it helps partially, or something like that. Okay, so the severity, it can be moderate to severe in intensity, and it can affect the daily life of the patient. So with any type of chronic headache, especially with migraine and tension headaches, the psychosocial parts becomes the most important part here. Okay, so you need to do the psychosocial. You need to ask, how is it affecting your life? Are you able to do your daily life activities? And is it affecting your mood? Because if he has been having headache for the last couple of months, and it is affecting his daily life, and he's in pain most of the time, so there is a good chance that he might be feeling low because of it. So you need to do psychosocial. How is it affecting you? How is it affecting your mood? Are you able to do your daily life activities, and how are you coping up? So that's the psychosocial part of it. All right. And when you ask about the past history of similar type of headaches, they will tell you that, yes, doctor, I've been having this headache on and off for the last maybe couple of months. Okay, and then you ask about past history of any other medical condition. Okay, and then regarding Meftosa medications, so you will ask about any medication that the patient might have tried, and also if it's a female patient, you need to ask about whether she's using any form of contraception. Okay, why is that? Because if this is a female patient and she has been having migraine with aura, and she's also using oral contraceptive pills, then you would need to stop the oral contraceptive pills, because it is an absolute contraindication for patients having migraine with aura to use oral contraceptive pills. So you would need to stop those. Okay, all right. And so in family history, they might tell you that yes, there is a family history, or family history might not be there. Okay, all right. And then the lifestyle question, you need to ask about alcohol consumption, caffeine consumption, and smoking, because sometimes alcohol consumption can trigger it. Also, you need to ask about how is your sleep. Okay, so ruling out the differential diagnosis for migraine, when you ask about anything else, they might give you something. They might tell you, the doctor, I've been vomiting, because vomiting is a common symptom with migraine. Then you need to elaborate vomiting. If the patient says, like, what, doctor? Then you need to rule out the red flags for the headache. So what are the red flags? Trauma. Number one, trauma. So have you hurt yourself recently by any chance? The patient will tell you no. Then you need to rule out meningitis and encephalitis. So and also subarachnoid hemorrhage. So you will ask, do you have any rash or fever, or does your neck hurts when you move it? Okay, so the patient will tell you no, because neck stiffness is there in subarachnoid hemorrhage as well, and the rest, that is fever, rash, and neck stiffness, are there in meningitis and encephalitis. You need to ask, is the light bothering you? Patient might tell you yes. Okay, the light, loud sound bother you? The patient might tell you yes, they bother me. Okay, so you have ruled out the red flags of the headache. That is trauma, meningitis, encephalitis, and subarachnoid hemorrhage. And also, one thing that is missing here, you need to ask about any visual symptoms. Okay, any problem with the vision, because it can be acute angle closure glaucoma or GCA. So you need to rule that out. Okay, so any problem with the vision, trauma, fever, rash, neck stiffness, meningitis, and subarachnoid hemorrhage, and acute angle closure glaucoma and GCA. So these are the red flags that you need to rule out. Okay, so moving on to the management, and so before moving on to the management, we will ask about the ideas, concerns, and expectations of the patient. Okay, then you will offer examination that I would like to examine you, and I will take a look. I will check your vitals, take a look at the back of your eyes, and I will check nerves, your face, arms, and legs. Okay. After that, you need to explain this to the patient that, as you told me that you've been feeling this headache for the last couple of months or so, and the symptoms that you describe, it seems like you are having migraines. Okay, migraine is a moderate to severe type of headache. It's a very common condition, and people with this condition keep on getting these unilateral headaches with these symptoms. Okay, so there are some things that you can do to decrease the severity and the frequency of these headaches, and there are some medication that we can give you. Okay, there's something that you can do about it, and there is something that we can give you to help with it. Okay, so first of all, give the general advice. As you can see here, there are basically four parts in the migraine management. First of all is general advice. So tell the patient that try to identify and avoid the triggers. Okay, so what you can do is you can keep a headache diary in which you can note the date, the time of the headache, any trigger that you might have noticed, and the medication that you took for it. Okay, also medications. The next thing is medications. So what we can do for you, we can give you some medications. So the patient might have already told you, the doctor, I've taken paracetamol, it didn't help, or it partially helped. So you tell the patient that, there are some medications like paracetamol and ibuprofen, and you can take them when you feel like the headache is coming. Okay, so you can take either paracetamol or ibuprofen, or the two of them together if you feel like that the headache is coming. Okay, but when the headache actually starts, I'm going to give you another medication, which is called triptan, and you need to take this medication when the headache stops. Okay, so this medication is a really good medication, and it aborts the headache, or it terminates the headache. Okay, so according to NICE case guideline, we can give paracetamol, ibuprofen, and aspirin, or these in any combination when the patient feels the aura. Okay, but if it doesn't help and the headache stops anyway, then the patient need to take triptan, and the triptans are they abort the headache. Okay, so the second point is medication. The third point is follow-up. So NICE states that you need to follow up the patient in 2 weeks to see how your plan and your management is working. So you can tell the patient that we will follow you up in about 4 weeks time or 6 weeks time to see how our management is working. Okay, so you told the patient about what they can do, that is identify and avoid the trigger and keep a headache diary, medications that you will give them, Okay, and then there are two types of medication. The medications, NSAIDs and paracetamol and triptans. Okay, and then tell them that we will follow you up in about 4 weeks time. And then the fourth part is safety netting, a very important part. So with any type of headache, whether there is migraine or cluster headache, really any sort of headache, you will safety net for meningitis and subarachnoid hemorrhage. So tell the patient that if you feel like your headache, you feel like your headache is unusual and there is fever, beige, neck stiffness, then or you feel like there is weakness in your arm or legs or there's slurring of speech, then please call 999 or come to the emergency department. Okay. The other thing is prophylactic treatment. So if in the psychosocial part, the patient tell you that they are getting these headaches for more than one time per week, like more than one time per week, and it is affecting their daily life activities, then you can offer prophylactic treatment. Okay. So for prophylactic treatment, you tell the patient that you need to take this medication daily, whether you feel the headache or not. And what they will do, they will decrease the chance of you getting the headache. Okay, so there are three types of prophylactic medication that we can give: Panadol, topiramate, and amitriptyline. So PTA, and then you will give the patient one of these medication depending upon the indication, the contraindication. For example, if the patient is asthmatic, then you cannot give propanol. If the patient is pregnant, then you cannot give topiramate. You will give propanol. So anyhow, you do not need to go into this detail for that too. So we have discussed the 4 points of management, general advice, then medications, follow-up, and safety netting. And also prophylactic treatment, if you feel like your patient will benefit it if they meet this criteria, that is they're getting the headache more than one time per week or it is affecting their daily life activities. Okay. So you tell the patient that you will be tackling it from all the three angles. That is avoiding the triggers and taking medications to terminate the headache or abort the headache, and taking these medications for to decrease the taking these medications, prophylactic medications or the preventive medications daily to decrease the chance of you getting the headache. So we will be tackling this from all three angles, and we will be following you up in about 4 weeks time to see how our plan is working. Okay, so I hope it was helpful, and next time I will do the psychosocial and the management of another type of headache, maybe cluster headache or GCA or something. So I wish you best of luck, and I will see you next time with another video.